Thank you for inviting me to talk about immune tox and also for helping with all your fundraising to fund this study. My name's Becky Lee. I'm a consultant medical oncologist in melanoma at the Christie Hospital in Manchester. I'm also a Wellcome Early Career Fellow, doing a lot of research actually in the lab, but I'm not going to talk to you about that today. Today I'm going to talk to you about the immune tox study. And so, as you've all heard and you're all very much aware, immune therapy has really kind of revolutionized the treatment for melanoma. Obviously, there is a long way to go still, but in terms of the kind of amazing strides that we've had, it really has changed things. It's significantly improved survival for patients with melanoma, and actually we're now bringing these treatments earlier and earlier. So obviously we've recently approved it for stage 2 melanoma. And this means that there's actually a huge number of people that have been treated with these drugs that are going to be long-term survivors of melanoma. And actually it then becomes much more important for them to focus on what happens in the future in order that they can then have a fulfilled life and hopefully not have too much problems with side effects from the treatments, having managed the melanoma side. Obviously, there are people that the treatment doesn't still work in, but this research is actually going to focus on those people that are doing well. And so because of this challenge, and because I think Joe's touched on a lot of the things that side effects of immune checkpoint inhibitors can really affect any body system. And this image just shows you some of the major side effects, and this is in more of the acute setting. And we actually don't have a similar kind of map for late effects, and that's because we don't really know very much about them. So we'd like to be able to come up with this kind of map for late effects as well as for the more acute side effects of melanoma. And so, as I've mentioned and as Joe mentioned as well, there's actually very little known about the late effects of treatment, and that's because some of it is because we've not had enough time, but some of it is because we haven't actually been doing research into it, and that's something that we wanted to address with this study. And so really what we're trying to do is understand a bit more about what's going on in terms of late effects from melanoma. So we do know some things, for example, hormone imbalances such as hypothyroidism, obviously chronic effects from the treatment that you have to live with. And those can have effects on other body systems. And we know from people that have had hypothyroidism for other reasons what potentially those late effects might be. There's also this kind of more theoretical aspect of a low-grade rumbling inflammation, and that can also potentially affect a lot of body systems, but we really don't know very much about that aspect. So that's something that we would like to try and understand better, and whether it is actually a real thing or just a hypothesis. There are some early data in mice and also some early data in human studies suggesting that potentially checkpoint inhibitors can have more of an effect on the cardiovascular system than we might think. So thinking about kind of atherosclerosis, so thickening of the arteries, and things like that we don't really understand and we want to learn more about. And as I said, there's many unanswered questions. We actually don't know, and we don't know what side effects occur down the line, and we don't know how frequently they occur. And that's really important because we don't know really what advice to give to people such as some of you in terms of what might be expected down the line and what things to look out for, and also what we can do to prevent them happening. we have a feel for some of the chronic and kind of long-lasting side effects, such as things like hypothyroidism and effect on the kidneys, but we don't have a good kind of ongoing long-term cohort of people that have had these side effects. And we also don't really know how these treatments interact with other health problems. So, for example, if you already have issues with your heart, how does that then affect if you're also having immune therapy in terms of your late effects? And also, who is actually at more risk of developing these issues later? So is it people that have already got underlying other conditions, or is it people that have more side effects during the acute side of treatment? Are they more at risk of things further down the line? These are all questions we just don't know at the minute, and these are some of the things that we want to try and address. And so, in terms of this immune tox study, so we're breaking it into 3 cohorts of people. So group 1 is what we call a control cohort. So they're the people that we're going to compare against. And these people are people that have had melanoma at an early stage, but haven't had immune therapy treatment probably before we started giving it, or they didn't want it at the time. And so there are controls. And then we're going to compare them to people who had treatment 1 to 2 years ago, and we're going to follow those people over time. So at the minute, the study's running for up to 6 years, and we're hoping to extend it. And then group 3 are a group of patients who are just about to start treatment. So we can then look at that question of whether the acute side effects of treatment, whether that then impacts them having more chance of having late effects further down the line. So taking all that data together, we should hopefully get quite a lot of information. And so we're going to collect both clinical and quality of life data on patients with melanoma who have received immune therapy. We're collecting the same data in that control cohort of patients. And we're looking at the number of what we call adverse events, so events that happen that are side effects or potentially, or just any event that's affected the health of that person in the period about 3 to 10 years post having the treatment. And we're looking at a whole range of body systems. And these are some of the assessments that we're going to be doing. So we're looking at things like quality of life, at fatigue. We're also interested in whether people's memory and cognition can be affected. So for instance, if there is kind of early signs of any dementia, and if that's more likely to happen in people that have received checkpoint inhibitors. So things like that could be targeted in future to prevent it. Also looking at frailty and whether that declines over time more rapidly. And then looking at things like blood tests, and also we're actually taking blood for future research and looking at more kind of more novel biomarkers and things like that in our research. So I've kind of talked to you about what we're planning on doing, but I thought perhaps you're probably asking the question, what can I do now when there isn't actually any evidence? So I kind of would say these would be the main things that I would focus on at the minute without kind of knowing much evidence. But what I would say is if you are on hormone replacements such as thyroxine, etc., do make sure that you take it, because we do know that if you have subtherapeutic levels of these drugs, of these hormones, then that can set you up for problems later on down the line. So make sure you take those drugs. I know sometimes, it doesn't matter if you forget the odd one, but consistently try and take them. Much of the research to date has kind of suggested that potentially there's an effect on the cardiovascular system. Again, this is all very preclinical and quite hypothesis generating, but to try and optimize your cardiovascular health will probably be important. So things like diet, so whilst feeding those bugs, they're probably the things that also are good for your heart health as well. Exercise, stopping smoking, making sure your cholesterol and blood pressure are good. And also, if you have taken steroids for a long period of time to treat some of these side effects, it is important to think about your bone health. So see if you can get a bone health check, and also regular exercise, particularly weight-bearing exercise, can be helpful. So those are kind of things that I would say without much evidence, but are probably good things to be doing. And just to kind of switch to something just a little bit different, we are also thinking about fertility and the effect potentially of these drugs on fertility. So we're actually about to open another study alongside this study in collaboration with researchers in Ireland, looking at potentially how immune checkpoint inhibitors could affect fertility. So again, this is something we don't really know very much about. Potentially the hormone imbalances that you can have as side effects from treatment could affect fertility. There potentially is a direct effect on egg and sperm production, and this kind of autoantibodies against yourself can also happen against sperm and eggs. So we're trying to understand these better and whether this is actually an issue or whether we can reassure people. And so we're looking at kind of the pre-treatment and also then on-treatment parameters. So that's just a really kind of overview of some of the things that we're trying to do in this space to try and give evidence. So at the minute, as I said, we don't know what these late effects are. We can only kind of give you some advice. But hopefully with the research that we're doing, and thank you so much for all the funding for it, we are hopefully going to be able to actually have that evidence that we can properly give you information about what to look out for in the future, and hopefully live a really fantastic, healthy life following a melanoma diagnosis. And just to acknowledge this huge kind of group of people, so it takes a huge lot of different specialties to try and understand these processes in the best way possible. So we've got a huge amount of expertise within our team, and just to thank everyone who's been involved in the study. Thank you very much.